Well, we now have multiple prospective randomized phase 3 studies that show if you take patients who have so-called activating EGFR mutations, whether exon 19 deletions or L858R mutations, and you randomize them to an EGFR tyrosine kinase inhibitor that could be erlotinib or gefitinib, or in this case, afatinib, those patients will always do better versus chemotherapy in terms of progression-free survival. What's interesting about this case is that the patient received afatinib for an exon 19 deletion. That scenario has become more recently a topic of discussion and debate because there were two large randomized trials that afatinib was compared against chemotherapy. One was called the LUX-Lung-3 trial, which compared afatinib versus cisplatin pemetrexed in a global population, though about a third of that was Asian. And then a second trial, which was called the LUX-Lung-7 trial, which compared afatinib versus cisplatin and gemcitabine. And what's interesting is that in those two trials, if you look at the patients who had exon 19 deletions, not only was there a progression-free survival advantage for afatinib, but there was an overall survival advantage. So one of the messages these days, and this is what's debated, is that if you have a patient with an exon 19 deletion, afatinib might be a drug you should think about first.